John Gerhardt, are you with us?
Captain John Gerhardt.
Good afternoon and welcome. I have a couple of required announcements to make. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, the administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. I have one other announcement. I want to note that some of our members are appearing via teleconference today, and you can see that we are seated to accommodate state and federal recommendations regarding social distancing relating to the current public health emergency. We are also continuing to time our meeting process to avoid non-essential items from our consideration. And with that, we'll start to seek approval of the orders of the day. Ask for a motion to approve. So moved. All those in favor respond by saying yes. Yes. The second item is the approval of the meeting of September 21st, 2020. Ask for approval, please. Motion, second. All those in favor respond by saying yes. Any corrections or errors? It's carried. Thank you. There are no board reports. Report of staff, Dr. Schulman, Chief of Staff. And before you start, Doctor, I speak on behalf of the board and the medical community of the hospital to thank you for your sacrifices last year in being Chief of Staff. Well done, Doctor. Can you hear me, Dr. Schulman?
She's on mute.
She's on. There you go.
Daryl Henry.
Dr. Schulman, can you hear me?
meeting.
Gerhard.
Okay, it says I joined the meeting.
Down there.
No. Okay.
Dr. Schulman, can you hear me?
I can. Thank you.
Can you get closer to the microphone, please?
Well, I'm sure that Dr. Schulman would join us and we
Okay.
because it's our.
Hold on.
I got it. You need
Hey,
me to
Dr. Schulman, can you hear me?
Can you hear me?
Yes.
Okay, good. It's time for my part?
Yes.
Okay,
Thank you.
sorry. Okay. Obviously, I wanted to thank you for such a great year, and you will be in good hands with Dr. Watson. But the work today is actually a whole lot of privilege forms. We have many privilege forms. They're all listed in your materials. They're for both physicians and advanced practice professionals. and they fill those out for the parameters with what they can do at the hospital. And they'll come with recommendations for approval from the various committees, including medical executive committee. And Mrs. Wexler to Peter has the list.
Thank you, Dr. Schulman.
Chaplain John Gerhardt.
Yes.
So I have two recommendations for approval. The first one is approval
Has
of
left the
privilege
meeting.
forms. I move approval of the SMH physician privilege forms as recommended by the Medical Executive Committee.
That's a motion, second.
All those in favor, say yes.
Yes.
Opposed? Motion carries.
The second item is approval of privilege forms. I move approval of the SMH Advanced Practice Professional Privilege Forms as recommended by the Medical Executive Committee.
Second. All those in favor, please respond by saying yes.
Yes.
Motion carries. Dr. Schulman, did you hear when I first came on, wanted to say thank you for the sacrifices you made as
Well, you're welcome.
I speak on behalf of the board and the medical community. The job well done.
Well, thank you. It was a unique sort of year. And it is kind of a shame you guys don't list plastic surgery for numbers, because for some reason being chief of staff did not hurt my numbers one bit. So thank you.
Thank you, Dr. Okay, we'll move along.
I got her now.
I'm sorry?
That was Daryl.
Okay. The secretary's report. Bri Reiner, our secretary?
Yes.
Wave that thing at me. What do you want me to do?
I can project, but thanks. All right, our next meeting is on Tuesday, November 17th, 2020, from 9 to 10:30. We will have the Mission and Planning Committee. From 10:30 to 11, it will be the Governance Effectiveness Committee, which is also the board annual committee. From 11 to noon, the Finance Committee will meet. From noon to 12:30 is the closed session of the hospital board. From 12:30 to 2 is the board lunch and issue and financial review. And then from 2 to 4 is the board meeting. Thank you.
Thank you, Britt. Treasurer's report, Joe DiVirgilio, our treasurer. Joe?
All right, I have one item today for action. I propose the following motion. I move approval of bad debt and charity care for the month ending September 30th, 2020 in the amount of $25,571,000.
Second.
All those in favor of accepting it, respond by saying yes.
Yes.
Opposed? It carries. Thank you, Joe. Financial highlights, William Volgen, Bill Volgen, our CFO, please. Bill.
Thank you. I have the financial highlights for September, and with this being the final month of our fiscal year, we do keep the books open longer in preparation for audit. So I won't have a report on revenue and expenses, but I will have a report for statistics. So starting with hospital statistics for average daily occupancy, and this is for the fiscal year, we had average daily occupancy of 584 patients compared to a budget of 565. We had admissions of 41,744 compared to a budget of 42,909. Our average acute length of stay was 4.51 days compared to last year was 4.29. The COVID pandemic did result in longer length of stay. For the hospital surgery cases over the fiscal year, 23,068 compared to a budget of 25,655. And births, we had 3,861 compared to a budget of 3,910. Our outpatient registrations, these were impacted by COVID pandemic. actual 419,909 compared to a budget of 472,420. And registrations in our two emergency care centers totaled 107,579 compared to a budget of 119,799. And that concludes my report.
Thank you, Bill. Quality Committee, Sharon, please.
Thank you, Mr. Chairman. The board continues to oversee and receive information on the various programs and committees working to assure that the care we provide our patients lives up to the Sarasota Memorial standards for quality and safety. However, because the Quality Committee of the board meets in closed session, I have no report.
Thank you, Sharon. President's report, David Barrender, please.
Thank you, Mr. Chairman. Bill, can you drive for me?
Yes.
Okay. So I'm going to start my report like I do each month with our organizational report card. Starting with the top line of service, which is our likelihood, our goal of having our likelihood
has joined the meeting.
The number of service areas greater than or equal to the 75th percentile. We have a goal of those be at that percentile. Happy to report we did for the year end up at 8 out of 10. And I'll show you the detail on that in just a minute. In the people category, we had a goal of having turnover of our part-time and full-time staff that had been hired in the last 12 months, be it at 23% or lower. I have to report that we did do better than that at 20.65% once we adjusted the numbers for COVID activity. In the quality area, we have a goal of having our infection prevention or the combined overall standardized infection rate being less than 0.9. Our year-end number came in at 0.77, so we did very well to that. Just to remind the board that the national average on that, or the expected, is a 1.0, so our goal is already set pretty significantly below that. So congratulations to our care teams for really delivering. In the finance area, as you saw Mr. Wojcik, our CFO, report, we have our finance operating margin as our goal being at 6.5%. We did come in at 9.2% is our projected number at this point. Needs to go through audit, but we feel very comfortable that that's where it's going to end up. And then finally, growth area, we had our two goals, the first being our inpatient admissions and outpatient observations, a goal being 50,047. We did come up short of that at 48,060. And our outpatient registrations at 684,000. We came up, we exceeded that once we adjusted for COVID activity on that at 691,000. Once again, the growth goals, both of those very significantly affected by COVID this year. The next page shows our patient experience report card, the detail on it, and what you see on the left-hand side is the departments that we take a look at. And I know we had some discussion in an earlier meeting this morning, but we do have first physicians and urgent cares and various outpatients on that, as well as a number of inpatient areas. The next column over is our final score. And then is the national median score, which you can tell that every one of our departments did better than national median. And then finally, what we look at is our 75th percentile score. So really congratulations to 8 out of 10 of our departments that actually exceeded the 75th percentile, and 2 that did not, or within 1 point each. So I think it's really a commendable year and a very difficult, some results for our people, a very difficult year. So congrats to all of that. Next slide. This was pretty well covered in the press, but we had a $25 million gift to our Advanced Cancer Centers mission. The Brian and Sheila Jellison Family Foundation is donating $25 million to the Sarasota Memorial Healthcare Foundation, which is the largest donation in the Healthcare Foundation's history to help advance the mission of Sarasota Memorial's Cancer Institute. In recognition of the gift, the Cancer Institute will now be known as the Brian D. Jellison Cancer Institute. And the Institute includes facilities that will give patients greater access to the latest treatments, technologies, and clinical trials in their community. SMH is one of the world's most wired hospitals. Really, congratulations to Pam Ramhoff and her whole entire team for making this very exclusive list. Sarasota has been recognized as one of the world's most wired hospitals. The College of Healthcare Information Management Executives, or CHIME, included SMH among the world's most tech-savvy hospitals that pioneer technologies to promote better and more secure patient care. SMH is one of only 5 hospitals in the Tampa Bay area to make the most wired list for 2020, and one of only 2 to earn level 9 certification out of 10 levels. CHIME conducts the annual survey to recognize the adoption of best practices in healthcare information technology, and SMH has won most wired recognition for 4 straight years. Congratulations, Pam.
What does a level 9 mean?
When Pam got level 9, she came in and told me that, but it was apparently a lot better than level 7, which was what we were at.
Pam's here.
Well, then Pam can come up and answer.
A level 9.
You gotta come up here.
Oh.
Here, I got it.
I'm going to go into a lot more detail in November when I kind of present the results along with the security focus. But the level 9 is really using your technology to support quality outcomes.
So staff is we've been recognizing our staff for their heroic work during this pandemic, and SMH SMH is recognizing staff for their hard work and dedication throughout the COVID-19 pandemic. This month, employees received grocery gift certificates and SMH Heroes t-shirts, which you see a picture above. Additional appreciation activities are continued for the weeks ahead. So we can't thank our staff enough for what they have done, for the sacrifices that they have made to continue serving our community and taking care of everyone that's here. Next, our Women and Children's Service Leader is honored. The Greater Sarasota Chamber of Commerce recently presented a Lifetime of Leadership Award to SMH Women and Children's Service Executive Director Pam White. The award celebrates alumni for the Chamber's Leadership Sarasota program who have and continue to serve our community. A member of the SMH team since 1981, Pam also serves on the Healthy Start Coalition Board, is a leader in the First 1,000 Days initiatives, was among the first members of the Suncoast Nursing Action Coalition, and helped establish an addiction support and pregnancy initiative. So we do thank Pam for all of her past service and continued service, and congratulate her on this honor. SMH names a Director of Research. We want to wish our congratulations to Tamala Fonseca, who has been named our Director of Research at SMH. Tamala joined SMH in 2008 and demonstrated leadership in a variety of roles, most recently as Clinical Manager of Oncology and Research. Her experience has been critical in providing investigative treatment options for SMH physicians caring for COVID-19 patients. As the new director of SMH's research program, Tamala will be instrumental in centralizing and standardizing the health system's research structure and processes. Construction progress on our SMH Venice campus. You have a couple pictures here. The right-hand picture is a generator that's just been installed. The far right is the lobby staircase, and the new hospital is on track to open in fall 2021. I think it's really shaping up to be a pretty amazing place. A lot of the classes on it now, if not most of it. And really, if you get a chance just to drive by on the interstate, you'll see it. Next, we have our construction progress on our Oncology Tower. The ground level concrete pour is complete. The wall frame is in process on levels 4 through 6. Overhead mechanical, electrical, plumbing rough ends continue. The October sign the wall event inscribes enduring messages for future patients. And the tower is on schedule to be completed at this time next year to fall 2021. So once again, really taking shape. A lot of glass on it now, and you can see what this is going to be looking like on our campus for some time to come. Next slide is our yearly mammogram Save Lives October is Breast Cancer Awareness Month. It's time to remember that breast cancer accounts for 30% of all new cancer cases among women worldwide, according to the American Cancer Society. An annual screening mammogram is recommended for women age 40 and older who do not have any breast cancer symptoms or concerns. The best prevention is early detection, so patients should not be delaying scheduling their mammogram. Next, we want to talk about the flu. The CDC recommends the annual flu vaccine as the first and most important step in protecting against the flu. This year, it's more important than ever to get a flu vaccine to help prevent COVID-19 and flu outbreaks that could happen at the same time. SMH has held flu vaccine clinics for staff, and flu shots are available at all of our urgent care centers, and a lot of different organizations around town have them. So we just encourage everyone to get out early and get your flu shots. And that is my report. I'm happy to answer any questions.
Thank you, David. There is nothing on the consent agenda. Members of the public wishing to make a comment to the board were provided an email box address that was open from noon yesterday until today. Karen, were there any emails to that box, and has anyone signed up to speak?
No, sir.
Thank you, Karen. Legal matters, Carolyn?
I have no report.
No other business? Having completed our agenda, we stand adjourned. Thank you.